Hello, everyone. My name is Ofira Bondorowsky. I'm the Director of Ratings and Nonprofit Engagement. I'm joined today by Stephen Rockwell, the Chief Ratings and Technology Officer at Charity Navigator, and Randi Shubin Dresner, who is our guest nonprofit leader for today, who's the CEO and President of Island Harvest Food Bank based in Long Island, and she'll be really helping us drive some important points home about leadership and adaptability and some of the points that we'll be discussing today and why it's so important for those of you on the call who are donors and for nonprofit leaders who may be tuning in as well, why these aspects are so important to consider in giving decisions and in terms of building and improving nonprofit performance. I'm going to hand it off to Stephen to take us through the general explanation of the Encompass rating system and the beacon that we recently launched, and then we'll move into a discussion period with Randi to talk more about specific nonprofit practice. Stephen?
Thanks. Warm welcome to everyone. I did hear today that there's going to be a nationwide alert at 2:20. So if you get a buzz on your phone, that's not from us. It's from the federal government. But hopefully it'll put an exclamation point on something we say today. Just wanted to give you that heads up. I just got that alert. So yes, as Ofira noted, we've got quite an interesting agenda ahead of us. Really, again, thank you for being here and continuing this journey with us as we build a better evaluation system for nonprofits together. Let me jump in. Today, we are really pleased to light up, if you will, our fourth and final beacon. It is a 4-beacon system, and we do this in a very in a release cycle type way now. We're living into a new reality. In the past, we presented a methodology and maybe had that methodology for 5 or 6 or 7 years, and in our new Encompass rating system, we're living into a new way of being, which is an agile and iterative process where we're going to have 3 releases each year: summer, fall, and spring. We want to avoid the giving season, so we're not doing a winter release. But each one of these releases is based on listening to experts, listening to nonprofits, listening to donors like yourself, about what's important to you in how you make a decision. And each release will either include some new metrics or some modifications. We'll be providing more information to you, hopefully in a better way. And we'll continue to revisit and reassess. I'm really glad Randi's with us. She's a member of our CCNL, our Consultative Council of Nonprofit Leaders. They are very important in terms of weighing in on methodology. And I would say even before this release, they helped us make some modifications to the methodology. And so if there's anyone else on the phone from the CCNL, I just want to say how much we appreciate that. Big announcement of many today, and that is that the Encompass rating system is coming out of beta. So what does that mean? Well, it means that we now are standing behind this as a complete and still very evolving rating system, right? That we now have all 4 beacons lit up in different ways, and we feel pretty comfortable about it, that we're not in the testing phase, if you will, but we're into more of a production. Please use this to make your giving decisions. That's one big announcement in addition to the leadership and adaptability. The other big announcement is that we're moving the star-rated nonprofit pages over into this new look. and that star-rated organizations can get these additional beacons that are sort of grew up in the Encompass rating system, if you will. And so you'll be able to see the, in the dashboard, you'll be able to see the star rating. You can click in and get more details. The star rating is still finance and accountability and transparency metrics. So these additional beacons at this point don't add up into the star system, but star rated organizations can now receive these beacons to help you make a better decision about to whom you're going to give, right? And so just that's a sort of our third big announcement of the day. We're going to put it all up front, and then we're going to get into some of the details of what some of this means. The Encompass pages are unchanged, except that many will now have this leadership and adaptability beacon. And like I said, we've got all four of these domains, these beacons now live in the system. Some are more developed than others, and part of what you're seeing here in the weights is that some are much more involved, and so we're weighting them differently. We're also making, you know, a different stand, if you will, about sort of what's important and what do we want to make sure we're measuring in the system. And so impact and results will be 50% of a score that's fully, this is again, if you've got all four beacons. Finance and accountability is 35%, culture and community is 5%, leadership and adaptability is 10%. These percentages change to the degree that you have, you know, one or two or three of these beacons in the system. And, you know, we've heard a lot of feedback, and we've heard a lot of really positive feedback, and a lot of really useful feedback from donors about how they're using Encompass and how they're using this new system to inform their giving. So let me just say a couple things about that. Obviously, this is the top level score, and we're giving this moniker, give with confidence. Everything is 75 and above in this rating system gets that moniker of give with confidence. We're standing behind, if you will, the rating about that organization at that level. And then there's these four beacons, as we've noted, in these three categories. And you know, one way to think about that is you can sort of evaluate what's important to you. So perhaps finance and accountability and transparency metrics are the most important thing to you. Well, in many cases, this is going to be scored, and you know, frankly, it's about 170,000 organizations where they're going to have that score, and so you may value that more. You may concentrate on that more. You may be more into impact and results. You may be, you'll hear leadership and adaptability today. Maybe that'll move you, and so you can sort of you know, pick and choose, if you will, the types of metrics and domains that are most important to you and how you think about the impact of a nonprofit organization. We'll just say this as a final statement on this, that we've also spent a lot of time not only listening to donors and listening to experts, but doing a lot of time thinking about, well, what does this rating system in fact measure? What does it mean? And I can tell you what we're aiming for. We're aiming to let you know that this is the organization's impact, both its direct program impact and maybe the other benefits it creates in the community. That's very much what we're trying to measure. And we're also trying to measure the ability for that organization to sustain that impact into the future, right? That's very much the story over time that we're hoping these ratings are telling you. Let's get into the new beacon today, leadership and adaptability. This is our first version. As you saw at the beginning, we're intending to version these things over time. This is the first time where nonprofits are submitting responses directly to us. You'll see a couple screens in a second where, just to make that real for you, but nonprofits are submitting their responses directly to Charity Navigator. And this is really the first opportunity that we've provided to have nonprofits do some storytelling. And storytelling is a big part of this beacon. It's a big part if you think about an organization that wants to communicate its impact in the world, and how it's adjusted over the last year in the pandemic, that we're providing that opportunity to the nonprofit to do that storytelling with you. And it's worth, for those donors that want to get in deeper, it's really worth reading those stories. That some of them are, and you'll hear today, are really, really powerful stories, and you'll want to glean from their profile page those stories. We developed this with a long list of interviews. I'm not going to, from leaders and from nonprofit leaders, from experts. I'm not going to go through this whole list. I just wanted to give you a sense that when we develop a methodology, we're really doing a deep dive into the field, and listening. We're reading literature, research, and listening to experts and leaders as we've developed this. We're also listening to you, donors, and I can tell you a few takeaways from our donor survey that are worth hearing. All the value, all the potential domains in this beacon were valued highly, but leadership was valued most amongst donors. And the most important leadership aspect from a donor perspective was that that leaders are externally focused and they're mobilizing resources for the mission of the organization. That came back as the most important thing. And by the way, you'll see that in the methodology. On adaptability, donors perceived that being responsive to changes in the external environment was most important. And interestingly, it was followed closely by the use of technology to improve efficiency and drive impact. You will not see technology measures today, but that is something that we'll explore over the next year. So is there a role for effective use of technology in the way we evaluate a nonprofit? And finally, as it relates to strategy, a clear articulation of mission, vision, and strategic goals was valued most. And you will see that in just a minute in the methodology. As I said, nonprofits responded to the methodology in our new nonprofit portal, which allows organizations to submit data directly to us. And so this was like if you will, like a proof for us of having a system that allows organizations to submit their stories, to submit their data to us processing a little bit, and then us rendering for donors on the profile page. We are still using 990 data. We're still using data from our partners at Candid. We'll continue to do that. We're continuing to look at data partnerships, and really, those are all really important to us. And we also want to make sure we're giving the opportunity for nonprofits to speak with us directly, and then thereby speak to you directly. So where did we land on the methodology for version 1 in the Leadership and Adaptability Beacon? We have divided it up into strategy, leadership, and adaptability, and giving a little bit more weight to strategy in this first version. And we're looking for the following things. We're looking in strategy, we're looking for that the nonprofit has provided some evidence of their strategic thinking and their goal setting. In leadership, we're looking for evidence internally on leadership development, and that they're investing in leadership development, and externally that they're mobilizing resources for their mission. We heard a lot about that external focus in regards to leadership from experts and from nonprofit leaders. And then in adaptability, it's really the nonprofit has the opportunity to tell the story of how their organization adapted to the tremendous external changes that we've all felt in the last year and a half. And that's really a big part of the storytelling in this. And just to break it down super quickly, in strategy, it's mission, vision, and give us your 3 most important strategic goals. There's an opportunity to share in an open-ended format, and then we asking the nonprofit to categorize, well, where does this goal fit? Are you starting a new program? Are you expanding and scaling an existing program? Are you maybe contracting a little bit to focus on core work? Are you investing in the capacity of the organization? These are all, really important, I think, markers, if you will, about and that we'll do more with over time. So, for example, if an organization tells us they're going to scale or that they're investing in capacity, we may end up shifting financial metrics to represent that strategic choice, right? We're not there yet. We don't have that dynamism built into the system yet, but we thought it was really important for nonprofits to share with us, share with you, their strategic goals, their strategic thinking, that evidence of strategic thinking, and to categorize those goals. On leadership, there's two components, as I said. One is leadership development, and do you invest in it? We give full credit either way, because if no, there might have been some impediments over the last 12 to 18 months to invest in leadership, and we really want organizations to be as expansive as possible with this. It doesn't necessarily just mean formal training, but it could mean giving your staff stretch assignments. It could be that we're incorporating leadership into our performance reviews. We really want nonprofits to be as expansive as possible in thinking about how they engage in leadership development. On the external focus side, and we've got what you'll see here on the nonprofit profile page, this mobilizing for mission and some of the different options there, including building strategic partnerships, being part of networks, engaging in thought leadership, raising awareness, community building, and yeah, policy advocacy too. That all those are activities that you can let us know about as a nonprofit, and then there's an opportunity for some narrative. So you can get a little bit deeper into how an organization is mobilizing externally. And then, like I've said, finally, it's these stories of adaptability. And there is a whole, as you see on our profile page, a whole storytelling opportunity. We're also thinking about doing more around digital storytelling there, and so you may see some evolution over the next year on that. But storytelling and these stories of adaptability, really encourage you to read some of those from your favorite nonprofit organizations. So I said a lot in a short period of time, and there'll be an opportunity to get into if you have any questions about that in the Q&A, but I did want to hand it back to Ofira so that we can engage in a discussion with some actual nonprofit leaders, which I'm pretty excited about.
Thanks, Stephen. Okay, so for those of you who joined us after we got started with the introductions, we're joined today by Randi Shubin Dresner, who is the president and CEO of Island Harvest, food bank based in Long Island. Randi, there's no doubt that when the pandemic hit, food banks were challenged to meet the extraordinary demands that you were faced with seemingly overnight. We were all kind of watching in awe as we saw those, drive-through lines established in mall parking lots across the country. Food banks hit with real challenges that they'd never had to face in the past. And so I'm wondering how, as we talk about leadership and adaptability, I'm kind of starting with your strategy for meeting these demands and how your organization moved quickly to realign strategic goals that may have existed or maybe develop new strategic goals in order to sustain and expand your reach.
The pandemic hit not just us organizationally, but obviously everybody that works for the food bank was impacted quite a bit. And things turned very, very quickly for us. We became a very adaptable organization. Shortly before the pandemic hit, we had just completed a strategic plan, and we were working through that 3-year strategic plan. But as soon as we opened up our emergency service work, we realized that that strategic plan was no longer valid. and we needed to readapt. And so we put together a quick new business plan using our former strategic plan as the foundation. And then we started to move forward in a new direction. And there were many things hitting us at the same time, so we needed to be adaptable. Right from the beginning, Island Harvest had to make a shift because we normally receive about 80% of our product that comes in was normally donated product, 20% would be purchased. Well, within 1 week, our supply chain completely closed up and we had to find a new resource. And so with the support of our board, we decided to go into complete purchase model. And so within 2 to 3 weeks, our purchasing was increased by over 500%. Now, many businesses, when you make a business shift and you shift 10% or 15% of your model, most businesses think that that's pretty dramatic. We shifted 500% and it was done fairly immediately. And so our team was adaptable. We were meeting frequently. We put plans together on a daily basis so that we could handle that. And there were a lot of other things that we needed to adapt to as well. Our agency network shut down. They all closed up because they didn't have volunteers to help them run their pantries. Their staffing needs changed. COVID requirements forced them to shut down some of their food programs. And so we became suddenly a direct delivery organization. And so while a small percentage of our work beforehand was direct delivery, it became 100%. And that required us to make a huge shift in our operational model. We had to hire staff when there were very few people that were willing to start a new job during the pandemic. So we had to be creative in that sense. And we found some really unique partners to work with to find some new staffing. We also had to learn how to set up some of these massive food distribution programs. While we would do massive food collections in the past, doing food distributions is far different. So we wound up with 4 of the largest food distribution events in New York State history, and we were able to turn that around fairly quickly. And so I'm really proud of the work that we did as a team, all working together and really recreating a new strategic plan for our emergency response work.
That's really amazing. And this kind of mobility and agility is not something you've ever had to experience in the past to this level. Is that right? So this whole change in culture was something you had to figure out on the fly somewhat.
Yes. So partially, we've been through many disasters before, but what we know about with disaster response is that there are no 2 disasters that are the same. And so with as much preparation as you have to understand that you need to work on the fly and be adaptable. You know, we did heavy response to Superstorm Sandy. We responded to 9/11. There were major fires on Long Island that we responded to. But each disaster is different. It requires different involvement. When you talk about a pandemic, imagine that our staff was going to work every day out of their homes. Against their families' wishes, by the way. Most of us, and me included, our families were back at home working remotely or not working at all. And we would get up in the morning, get dressed for work and go out. And our families were standing at the door pleading with us not to leave because, especially in the beginning, nobody knew about the virus and how it would impact us. But we all were part of the same mission and the same goal. We had an organization to run, people that needed our support. And I was really honored and proud to work with such an incredible team of people. And again, we've been through disasters before, but each disaster is very, very different and requires us to be patient enough to stop, think, look around us, and make those changes so we could continue to move forward.
And so for donors on listening in, you can find more or learn more about how Randi's organization has addressed their strategic goal planning and leadership and development needs and have adapted right on Island Harvest profile page at Charity Navigator. If you click on the Leadership and Adaptability beacon, it will drop you down and you can get all of this detail. But you understand just from listening to Randi why it's so important to understand a nonprofit's story and understand more about the organization in a comprehensive way that goes far beyond any financial, metrics on their own. And so that's been our goal in bringing Encompass to you and in publishing this beacon. And as a welcome surprise, we're joined here by Thomas Tighe. I'll take a second to introduce you. Thomas is the CEO and president of Direct Relief. For those of you who may not be familiar with Direct Relief, if I'm not mistaken, I think you are the third largest charity in the U.S. Last I checked, but providing disaster relief, recovery services, and supporting communities, bolstering communities in advance of disasters so that they're better able to weather disasters of various kinds, including health and environmental, both in the U.S. and internationally. Thomas, thank you so much for joining us.
We were doing a little. I apologize for being late. We had a COVID-related kind of international charter of a monoclonal antibody going to Indonesia that got accelerated by 12 hours. So it was one of those kind of three-ring circuses. But thank you, and thank you for what you're doing. It's really appreciate what I was able to hear, and also what I know you've been doing, trying to give it some more context to how people can understand what charitable organizations do beyond the kind of the one-dimensional lens of financial, which is important. And so thank you for the effort. It's, I think, a struggle we all go through. Everyone wants data, and a lot of it's just kind of confusing. So I think try to bring it into some perspective is a challenge, I think, for everyone. I really appreciate what Randi said about the things that she went through and that aren't going to show up on your 990. There's no way of knowing that unless you. So I think to have a structure to present that, so people who deserve to understand what we're doing with their money and why can have a chance to do that in a structured way. So many thanks.
Yeah. So Thomas, I am very interested. I'd looked over the responses that Direct Relief had submitted as well to the Leadership and Adaptability Survey, which is published on our site. And was really intrigued by some of the work that you've done with Harvard University to collect cell phone mobility data, to track kind of population mobility during the time of the pandemic. And I'm wondering if you'd speak a little bit more to that as, not so much as solely as an initiative that you've undertaken, but how you see the future of this kind of information being utilized potentially to advocate for better services, more resources, or to lead to systems change, policies at a legal level as well, not just a community level. Can you tell us a little bit more about your vision for this?
Yeah, I think that was kind of an iteration of something we've been doing for several years. I think, emergencies by definition disrupt the equilibrium. And I think whether it's a natural disaster or pandemic, I think the equilibrium needs to get reset. And there's a reallocation of resources in a concentrated period of time, which is why they're often so chaotic. So one of the big things in natural disasters has been, like a hurricane has traditionally been covered as a meteorological event. Everyone's talking about wind speed and barometric pressure, but we've always looked at it as like these are hugely disruptive social events with significant health consequences. Less so than barometric pressure, like who's at risk and where. But a big thing in these, whether it's wildfires in California or hurricanes, the question is where people are going, because the people with chronic illness who get evacuated statistically are the ones who end up in crisis when they're disrupted from their normal, whether it's asthma or diabetes or hypertension. It doesn't take much to have a chronically managed condition become an acute crisis if that's interrupted. So the big question is, well, where do people go? We don't want to send help to where they were. So I think the advent of, we have data sharing agreements with all the privacy protections, anonymized data with Facebook, for example, where they do have such it's like Google traffic for people, right? There's so many people with that app on their phone who have the location data. So you can actually have a good proxy for where people are going and where you can make some reasonable estimations of where services are going to be needed close to real time. And so with the pandemic, what we learned was, they pulled this big lever of social control, like stay at home. And then that's a big lever to pull in society. And then the question was, are people staying at home, right? And so our research team worked with Facebook and the researchers at Harvard to say, well, first of all, are they staying at home? What can we learn on a county, or if people are staying put, the risk of transmission of the virus was reduced. And conversely, where the population was pretty mobile, it was a really good predictor about where infections were going to spike in about 10 days to 2 weeks. So it just became a standardized report that the data scientists from, we were looking at it for, what should we do? What can we know? But I think the people at Facebook, their Data for Good team, the researchers at Harvard kind of developed kind of a standardized report for whether people were staying put or not. And it was a pretty good proxy for where future infection rates might spike. So that was kind of an iteration of what we were already doing, looking at the spatial information with respect to people in emergencies. And we're still iterating that now, trying to look at where infection rates are, where hotspots break out, and really the spatial relationship between people and services is something that's kind of a chronic issue. It's a real challenge when, typically emergencies happen in one place, so you can mobilize resources from one place and bring them to where they're needed. It's quite a challenge when, the pressure is everywhere simultaneously, and you're trying to mobilize global resources and disperse them globally. So it was, a way that, we adapted what we could because we had some basis for the tools, but I think also just in terms of, the function we perform is one of them is the distribution of medical commodities and prescription drugs, which is very heavily regulated. We have to have special accreditations and licensing in all 50 states and deal with all the navigation in the world because every country regulates prescription medications. So really trying to, PPE, we had the good fortune of having stockpiles. We do it for the wildfires in California. So we were able to move pretty fast, but we were also able to get the early signals from Wuhan, where we were hugely surprised to me. We were asked to help because we had stocks of PPE that we buy in China. And it's all, NIOSH approved that we actually manufacture ourselves. And we had no confidence that we would be permitted to export to China, but it happened, and that was January of 2020. So by the time it appeared, the virus appeared in the States, we were already running full speed and had a pretty good sense that how it was likely to play out. And we just weren't prepared. I mean, we have a just-in-time economy. Businesses hate stockpiling because, why are you going to stockpile something, pay for it, something that people might not buy? We don't mind it at all because just-in-time is great until it doesn't work. When there's a huge spike in demand and you can't ramp up supply, the shortages come, the price hikes come, and that always happens. So we're trying to hedge against that with stockpiling, amping up our distribution capabilities generally, making sure we had contracts in place and channels that were identified. But the information collection, we mobilize private resources for the public benefit, basically. The resources being medical material, medication specifically, PPE, money that we mobilize. And if we don't need it, we'll provide that in the form of cash support to the groups that we're helping because they need help, but also mobilizing private information for the public benefit. And there's so much of it that's being collected for the private benefit. It's not, I think there's no way to collect the amount of information that we could independently. So working with the technology companies has been enormously helpful to give us a new lens on where people are as events unfold.
That's amazing. I have one more question for you both, and then I think what we're going to do is take some questions from our viewers, from our audience. But I am curious, and this is not something we've necessarily asked just yet. I am curious. Both of you are familiar with disaster relief. You're in this, field, and as you've both noted, every disaster is different. No two disasters are exactly the same. But certainly COVID, this pandemic, is unique in so many ways and unprecedented in so many ways. Are there any learnings that you have taken over the last, year and a half, 2 years of kind of racing to meet the needs that stuck, that will now be folded into your new normal or your new strategic thinking about the way forward as a result of what your organizations have experienced through this particular pandemic? Randi, you want to start us off?
I was hoping Thomas would go first. It would give me a second to think more, but that's okay. The learnings continue because we're still in the work. I think that, communication is key. We need to make sure, and I would always continue very frequent meetings. Learning and understanding what's happening on the ground level was important to us. For myself, as a leader, I needed to be out there to see it. And so I spent a lot of time in the field so that I could bring the information back from my perspective. I think the way a leader of an organization looks at a situation is different from people that are at different levels within the organization. The lens is different. And I think that my lens was important because I was able to then report back to our board of directors, to our funders, and to give credibility to the need and the response that we had. I think also recognizing that it's not just what's in front of you that we all as leaders need to be looking at. We need to be looking at a sort of 360-degree vision to understand the full landscape of what's going on. Early on when our full network, 400 community-based nonprofit organizations shut down fairly quickly, we could have easily done the same and just reported to our board the process isn't there, we'll shut down and come back in a couple of weeks and reassess. But we look broad. We look to find what kind of partners are there in the community that can help us. We needed to find some truck drivers and some trucks. So what did we do? We looked at the industries that shut down because of the pandemic. And we knew that they wanted to be out working, but they couldn't. So we turned to some food distributors. They had trucks that were sitting idle. They had drivers that they were paying for that were sitting idle. And in some cases, they had a lot of product that was going to go to waste because they didn't know where to pass it along to get it out into the community. And so again, because we were able to look broadly, we were able to uncover the problems quickly, meet as a team frequently, make decisions quickly, and then implement the decisions. And so I think our board also appreciated that we had almost in the beginning, almost weekly board meetings where we were reporting into the board either directly through Zoom or through full reports that we were putting together on paper that we would send out to them. It was important that the board knew because they're in the community too, they're community leaders. And so it would be pretty natural that someone would turn to a board member to say, gee, there's a problem in such and such a zip code. And, I don't know if your organization's available or been involved. Well, our board was able to answer those kinds of questions because they knew exactly where we were. In some cases, they were standing right next to us, shoulder to shoulder, to do the work. And so I think those were some of the learnings that we came up with. And the other is sort of the build it, they will come. Some of these things are costly and they're not always, we don't always have those funds sitting there waiting so that when a disaster hits, we could just go into that pool of funding. And so, well, one, that's a learning that we definitely need to create that emergency relief fund, which we had talked about for a number of years. But also, again, that transparency with our board to be really clear, to set some things up so our contributor community would know how to support us and give us what we needed, when we needed it, how we needed it was important. And so we were able to be responsive to that as well. So thanks for the question. I really appreciate that.
Great response. I mean, I'm learning so much just listening to you about the ins and outs of what you've been through. That's why these stories are so important. Thomas, I know direct relief has been, this is your core mission is disaster relief, but certainly there have been new learnings as a result of COVID. What are you taking? What are the takeaways for your organization?
Yeah, I think, as Randy said, some of them are just reinforcing what we do. I think it used to be kind of a debate, are you a disaster response organization or are you a development organization? Which I, thought was kind of crazy, since the biggest impediment to development is natural disasters. So, I mean, you can't really do one without the other. And so I think what we looked at was just developing a range of capabilities that, at the abstract level, I mean, everyone knows technology is looming large. It's, what are the applications of we know commercially for the type of work we do? I mean, there's expectations that are normal as consumers that should be normal when it's a nonprofit service given for free. So we've really tried to look at what the business community does, because they have to survive, because those adaptations are pushed and tested, whether it's a distribution mechanism. We set out to model a type of activity, whether it's kind of Facebook being able to, understand location of its users, what the applications are. And also, I think, the insight is that, any emergency, it exposes what was already there. So, where direct relief was working in all 50 states and 100 countries, it was for a reason before COVID. It was, people who need help accessing basic services that they can't afford, the governments aren't in a position to provide, and are otherwise unavailable. So, that's why you have charitable organizations. And so here along comes COVID. Like any disaster, it makes what was already bad worse. It exacerbates the chronic problems and brings an acute crisis on top of them. And we knew that, the people who were in the toughest shape before were going to get slammed the hardest, because that always happens. And so for us, I think that one of the adaptations was you have to focus on, particularly if it's prescription drugs, you have to be really good at that. But then thinking, if we can do that, the level of diligence that we have to go through to provide a grant of a prescription medication is so much higher than is needed to give a financial grant. We said, well, why don't, that's a helpful resource too to these groups that we're providing assistance to, these nonprofit community health centers and free and charitable clinics. So as money came in, let's open up a channel as a grant making entity, which is typically not our core strength. And, we found ourselves dispersing over $50 million, $100 million over the past 24 months, like equivalent to $1 billion foundation that, our aim was like support the people we know well already, be as frictionless as possible. How do you do that well? Like Fidelity Charitable would do it, because they're actually doing it very well, have a great interface. They do it for free because they're doing it adjunct to their commercial activity. So I think those kinds of insights, at the same time seeing it's been a government-centric focus naturally on how the response is going, but a lot of the activity itself, government's funding it, but not doing it. So really taking an honest assessment of like the medical distribution function, the structures that exist for the public benefit did not work. The National Strategic Stockpile did not work. It had ventilators that were out of date or broken or not used. It had a lot of masks that were too old and the bands were breaking. And, that was okay, but don't recognize that and see what options exist. So I think, I think the intimidating thing looking forward is so much of the talent and the resources, the energy and the innovations are occurring in the private sector. I mean, because they have to. The talent migrates there, the incentives are strong, but we're looking at expectations of government as the deliverer of services. I mean, you know, like what Randi's doing, you know, government sets policy, does all these things, we're listening to them. They're not delivering food in a crisis. We know how to do that really well commercially. I mean, grocery stores are incredibly advanced. You know, they're tracking eggs for salmonella. I mean, you know, the level of inventory controls commercially that we know exists in our own country. So we've been thinking, how do you bring those learnings and things to bear that we all know as consumers? Why is it that they're not present when really the public needs help? And you can't really expect businesses to bankrupt themselves, but how do you adapt those tools and approaches and insights that for functional performance to serve the public benefit as they're well known to us as individuals in our private lives? So I think those are the takeaways. We try to look through that lens with fresh eyes and say, where are we now? Forget about where we thought we were going to be. Where are we now? What are the other factors likely to be going forward? Is government going to become a better and bigger provider of services or not? How you assess that question really should determine how much you want to lean into with private money. You know, our assessment is that you know, a lot of places internationally don't have the robust private industry and a government that can write checks to a kind of an unlimited degree. That does not exist in a lot of the world. So we're looking at how to strengthen the rather weak distribution mechanisms that do exist for things like cold chain distribution, which is important now for obviously the COVID vaccine, but that's a chronic problem too. And we know that. So we're trying to sort of lean into that and say, how can you mobilize private resources to at least make a dent and actually model what's possible for those government agencies in a lot of developing countries, that really that is the only option they have going forward. They can't rely on Pfizer, Moderna, J&J, and all these groups to just come up with a vaccine, and they can't just start writing checks to FedEx, UPS, and McKesson to handle the distribution. That's uniquely an American dynamic, and we're really fortunate to be in this country. You look at a lot of the world, they don't have a government that can do that, and they don't have the robust private industry to fall back on to get hired to do it. So it's a huge, you know, question about the roles that nonprofit organizations for the public benefit are going to play relative to the roles that government's going to play, and how to invite the participation of the talent and resources that exist in private industry. And that's kind of the puzzle we're trying to put together as we move forward.
Excellent. So we are going to use the last few minutes of this webinar to field some questions from our audience. And so I'm going to pass it off to Stacy to take us through that.
Thanks so much, Ofira. Okay, so thank you. This brings us to the end of our formal presentation. We do have a number of questions that have come in, so we're going to try to fly through them as quickly as possible. Here's our first question. Since donors value innovation, why is innovation omitted from the leadership and adaptability weighting?
It's a good question. Innovation was actually valued the least in our donor survey. I think we're going to do some work over the next year to figure out what that's all about. We think it's pretty important, but we also want to maybe give it its own space in a release and really think about how to measure innovation, if you will. That's not straightforward, and so we've got a lot of listening to do to experts on that to figure that out. But you should. While all tested as important, that was actually the least important in the donor feedback.
I'm going to keep you here, Stephen. So I have a couple of questions. Okay, how will multiple leadership transitions and employee turnover impact the rating in the leadership and adaptability beacon?
That's actually a great question. We spent some time thinking about whether to include succession planning as a metric. Do you have a succession plan that may in fact show up in a future version? Because we know that the sector right now is going through some generational shifts, of which that succession planning is really important. So with all of these, I would say this is our first version. We're putting it out there. We're learning from you. We're learning from nonprofits, and we intend to improve over time. And that's one metric in particular we're going to pay close attention to.
Okay, so I have it's the second question for you, Stephen. Since leadership is the most important to donors, why is it weighted less than strategy?
Yeah, it performed the best with donors. They all were important. And I would say that what's important to note here is that the system itself is not completely donor derived. It's donor serving. And there's a difference there. We are listening to lots of different voices. We're listening to nonprofits. We're listening to experts in the field. We're listening to donors. And then using our own judgment in some cases to sort of say, okay, here's what we think the right methodology is at least for now. And so you have to put some stakes in the ground. But I do think it's highly reflective of, at this point, of donor preference and what we heard from donors. We tested it all out and feel pretty confident that we're not throwing any curveballs or things that aren't valued by donors into the methodology.
Thanks, Stephen. Thomas, I think I have a question for you. How do you, Direct Relief, interact with FEMA, if at all?
I think we make a conscious effort to share with all the government agencies we work with what we're able to do, willing to do, or are doing. And ask, I think particularly pandemics, the public officials, health officials have to lead these things, and they do in most emergencies. They have to have the full field view, but it's important for them to realize they don't have to do everything if there are willing, able resources. And so that coordination, I mean, every after action report from the beginning of time has concluded, it has the same title, coordination was lacking, right? I mean, communications could have been better, So you do the best you can. I think California in particular has a structure that was set up probably 14 years ago or something, where they actually have when they declare an emergency, there are identified members of the private sector as part of this business operations center that can serve as a channel for resources that become available, so the public officials know that they exist. So, if something's available, they don't have to buy it. Or conversely, if there's a need that exists that isn't covered, that's something that they could send out. And we're the kind of the lead for the health kind of division. If they're getting a signal that an item is needed or resources are needed that is not covered, then they can kind of put that to us, and then we can go see if anyone's willing or able to provide that. So I think with FEMA plays a key role. It is the financial mechanism to disperse funds and provide some direct services, but mainly a coordinating and financing role. And we just want to make sure that we don't get in their way, but also that they know what we're doing. We're typically fairly nichey because we're one of a handful. We were the only one for years that was accredited to provide and licensed to distribute prescription medications in all 50 states. So we have rather unique licensing and capabilities in that regard. So it doesn't really interact with FEMA too much, but it's important. The general point is just everyone should, to the extent possible, know what others are doing, so you're not doubling down or wasting money or getting in each other's way.
Randi, thanks so much for that, Thomas. Randi, just tagging on to what Thomas just said, kind of a similar question. Does your organization also kind of interact with other non-governmental organizations or governmental organizations out there, agencies out there?
Absolutely, thank you for the question. First of all, Island Harvest Food Bank is part of a very large network of food banks across the country through Feeding America. And so through that network, every single county in the country is supported by a food bank. And so the way we've evolved over the past 10 years, when a disaster strikes anywhere in the country, we all band together and provide support to the impacted food bank. And so if it was the fires in California, and there were people that were in need out there, that food bank would get information directly to Feeding America. Feeding America would get that information out to the network, and then we would all offer in whatever we could. When we were responding to Superstorm Sandy, for example, we got trucks from Boston Food Bank here for several months. We had people from South Carolina spend time here, Oregon. Everybody just lends their expertise. And in addition, we're also supporting with excess surplus product that we may have for a short-term need. One of the things that happen in disasters is that people just the community just tends to try to reach out for whatever they can and send donations. And oftentimes we don't need the product, we need the funding and the expertise. And so that's what we do in a coordinated fashion. We also work with a lot of other organizations. We do work with FEMA. We work with the Office of Emergency Management in our community, but I know across the country as well, and with other disaster organizations, and work as closely as we can in a uniformed way. There are times where there's some overlap of work, and the more we communicate with each other, the less we are doing that overlap. And each disaster we learn for the next, because as I said before, each disaster is different, and that helps us to move forward. So we look forward to those relationships. We have a lot of memos of understanding with a lot of the organizations, just to make sure that we could be where we need to be at that moment in time with the right product, the right support, the right service.
If I could hop in, Stacey.
Please.
We actually try to coordinate with Feeding America. I mean, just to, nonprofits are great at kind of self-identifying by what sector they work in. Like, what sector do you work in? Right? We're kind of accustomed to that. It's a weird concept, since I'm pretty sure that every member of the human species is a member of every sector, right? But the nonprofits sort of say, well, I'm in the health sector, I'm in the nutrition sector, or the food nutrition. You know what? The same people who go to the nonprofit community health centers and free clinics that directly supports are the same people who rely on the nutritional support that comes from Feeding America and the food banks, like Randi runs. And we know that. So I think it's I think the evolution is, it's the dilemma of specialization, right? You kind of learn more and more about less and less. So you have to keep a wide angle lens and recognize that ultimately it's serving people. And animals are important too, I think, in natural disasters, but to recognize that whatever priority that you have is not the exact only priority that everyone that you're serving has either. And I think, Feeding America is great. It's got a good network. So does the National Association of Community Health Centers and the State National Association of Free and Charitable Clinics that we work with. But it's also the Boys and Girls Club. I mean, the social support and the after-school programs, it's the same people. And I think, the evolution of how we can work together, it's less expensive if we do it. I think there's perhaps more overlap than there needs to be. And I think that certainly there's not enough money for each group to just, handle it on a sector by sector basis. I think that's the lateral looking around that you have to do. And Randi talked about, earlier in her comments. Sorry to jump in.
No, that's great.
I think another point is that all of our organizations are also evolving. If we're not working in a disaster, we're evolving our organizations and expanding programs and services. And so how we respond to one disaster, the next disaster, we're at a different point. And so we've now taken on a lot of new programs and services where food is not the most important part of what we do. It's important, but the front of the house is important also. And so our services and support outreach that we do is almost equally as important as that food. And so with each new disaster we come across, or quite frankly, each new year that we come up with, our services get adapted a little bit. We have to be nimble, all of us, because it's not about us as an organization. It's about what the community needs and how we can best support and serve that community.
I think maybe we should close on that. We're a
Yeah.
couple minutes over, but I just wanted to note that the demonstration of leadership of what you just heard, of that external focus, that working cross sector, all of that is part of what we're trying to capture in that. We talked a lot about adaptability today, but it's also part of what we're trying to capture in that leadership question in the methodology. And I just want to thank both of our guests, Randi and Thomas, for being exemplary in that and just sort of putting that on display for us today. Really appreciate it. And I appreciate everyone joining us today, and feel free to shoot us questions that we didn't get to. And again, thank you. Thanks, everyone.